You had mentioned that the tranquilizers over the long term do cause brain damage.
They can. They can. It depends which one you're using. The old drugs like Haldol, in my opinion, do not cause brain damage. I'm not talking about things like Haldol and chlorpromazine. The ones that I'm worried about are the new antipsychotics like risperidol and olanzapine, the Prexa. These are the ones that I'm concerned about. They can cause brain damage, but worse than that, they do have major side effects. They cause obesity, increased diabetes, increased triglycerides, increased cholesterol levels. They cause these terrible metabolic changes in patients. Many of our patients become fat and sick, totally unable to work. I had a young woman came to me when she was 19. She was being well controlled with Haldol by her psychiatrist in Vancouver. He wanted to test a new drug out, so he put her on a new drug, one of the new antipsychotics, and within 6 months she gained 80 pounds. Her life was destroyed. This young girl of 19 now looked like a sack of flour. And she pleaded with him, please, I don't want to take this, I want to go back to the Haldol, and he wouldn't do it. Now this girl's life is being destroyed by the tranquilizer. She's never going to get better.
I was wondering if you could maybe talk to us about another case I read where you had started counseling a young man who was on olanzapine, or the one that gives you obesity, and he was going to start your treatment, but then his psychiatrist convinced him not to, and then he ended up hanging himself.
I won't talk about anyone in particular, but there's several. They didn't hang themselves, they committed suicide the more usual way. Men don't hang themselves very often in Canada. They use guns and they use knives and things. Anyway, I've had several, not just one, I've had several patients who I had on my treatment program who were recovering. But as with any disease, now and then you relapse. They might have stopped taking their medication, they might have got the flu. There are all sorts of explanations for why they might have a relapse. And the usual thing is that you go back into a hospital and you deal with what is wrong, and then you keep them on the same program. And these young men were doing pretty well on my program, but they went through a minor relapse. They went to the psychiatric ward where they wouldn't let them take their vitamins in hospital. And when they were discharged, the patient didn't come back to see me. And a few months after that, committed suicide. I've never yet had a single schizophrenic patient on orthomolecular treatment commit suicide. It never happens. So I think so. It's very frustrating to have these things happening all the time.